Studies show that people over 80 who take blood pressure medicine don't actually live longer. They just have more side effects, more dizziness, more weakness, more falls. If your blood pressure is slightly elevated, try this first. Walk more, eat less salt, reduce stress, sleep better, lose a little weight if you need to. These things actually work. If you're already on blood pressure medicine and you're feeling dizzy or weak, talk to your doctor. Really talk. Say, "This is making me feel bad. Can we try stopping it?" Because sometimes you can. Remember, the goal is to help you live well, not to treat a number. The second one is high cholesterol. Your cholesterol comes back at 220 or 230 or 240, and your doctor says you need a statin. You need to lower your cholesterol. You need to take this medication for the rest of your life. But wait, let's think about this. Cholesterol is something your body needs. Your brain is made of cholesterol. Your hormones need cholesterol. Your cells need cholesterol to survive. Cholesterol isn't poison. It's necessary. Now, there's a certain kind of cholesterol, LDL, that can contribute to heart disease if you have too much of it and other risk factors. But here's the thing. Just having a number that's slightly high doesn't mean you're going to have a heart attack. A lot of people live long, healthy lives with cholesterol that would make a doctor nervous. Statins cause muscle pain, real pain, the kind that makes it hard to move, to exercise, to do the things you love. And when you stop exercising because of muscle pain, you get weaker. You get depressed. Your health gets worse in other ways. Statins can cause memory problems and confusion. They can affect your liver. They can cause sexual dysfunction. And here's the thing. These aren't rare side effects. They're common. They happen to a lot of people. Studies on people over 80 show that taking statin drugs doesn't help them live longer. It doesn't prevent heart attacks. It doesn't prevent strokes. But it does cause side effects that make people miserable. If your cholesterol is slightly elevated, eat better food. Move your body. Don't smoke. These things actually help. And they don't have side effects. If you're on a statin and you're having muscle pain, or you're feeling weak, or you're having memory problems, talk to your doctor. You can probably stop it. The third one is osteoporosis. A woman goes in for a bone scan. The scan shows that her bones are a little thinner than they used to be. And suddenly she's told she has osteoporosis. Suddenly she's told her bones are fragile. Suddenly she's told she needs medication to strengthen her bones. But here's the thing. Bone density naturally decreases as you age, especially for women after menopause. It's part of aging. Almost all older women have some bone loss. And here's what's really important. Having thinner bones doesn't mean you're going to break bones. A lot of people have thin bones and never break anything. A lot of people have dense bones and break things. The test is called a T-score. And the cutoff for osteoporosis was chosen somewhat arbitrarily by a medical committee. It's not like there's some magic number where suddenly you get brittle. It's just a line on a chart. The medications for osteoporosis come with their own risks. Bisphosphonates, the most common osteoporosis drugs, can cause jaw problems. They can cause unusual fractures. They can cause heart problems. They sit in your bones for years after you stop taking them. And here's the thing. If you're exercising, if you're getting enough calcium, if you're not falling, you probably don't need these medications. Move your body. Weight-bearing exercise actually builds bone. Walking, dancing, gardening, climbing stairs. These things make your bones stronger naturally. Make sure you're getting enough calcium. Eat cheese. Eat leafy greens. Drink milk. You don't need a supplement if you eat real food. Don't fall. This is the most important one. It doesn't matter how thick your bones are if you don't fall. So make your house safe. Wear good shoes. Use a cane if you need one. Do balance exercises. Don't drink too much alcohol. If you're on an osteoporosis medication and you're not sure you need it, talk to your doctor. You can probably stop it, especially if you're exercising and eating well. The fourth one is type 2 diabetes. Your blood sugar comes back at 110 fasting, or 125, and your doctor says, you have diabetes. You have a disease. and here comes the medication. But wait, blood sugar naturally goes up a little bit as you get older. Your pancreas doesn't work quite as efficiently. Your body doesn't use insulin quite as well. That's aging. And here's what most people don't realize. Having a blood sugar number that's slightly elevated isn't the same as having diabetes. It's called prediabetes. And a lot of people with prediabetes never develop actual diabetes. A lot of people live their whole lives with slightly elevated blood sugar and never have a problem. Diabetes medications cause low blood sugar, really low blood sugar, low enough to cause confusion, shakiness, sweating, and even seizures. And when an older person has low blood sugar, they can fall. They can have a heart attack. They can have a stroke. The medication you took to prevent complications of diabetes instead caused a low blood sugar episode that landed you in the hospital. And diabetes medications cause weight gain, which makes diabetes worse, which requires more medication. It's a downward spiral. The same thing that actually works. Move your body. Eat better food. Lose weight if you need to. Reduce stress. Sleep better. These things actually improve blood sugar naturally, and they don't have side effects. Cut down on refined carbohydrates. Eat more vegetables. Eat more protein. Eat real food, not processed food. If you're on diabetes medication and you're having low blood sugar episodes, or you're gaining weight, talk to your doctor about stopping it or reducing it. The fifth one is arthritis. You get stiff in the morning. Your knees hurt a little when you climb stairs. Your hands ache when it's cold, and you're told you have arthritis. You're told your joints are degenerating. You're told you need medication. But here's the truth. Arthritis is just what happens to joints after they've been working for 70, 80 years. Your cartilage gets thinner. Your joints get stiffer. That's normal. That's not a disease. That's evidence that you've lived a full life. Almost everybody over 65 has some arthritis. It's that common. And a lot of people with arthritis feel just fine. A lot of people move well and do the things they love and don't need treatment. Arthritis medications, especially NSAIDs like ibuprofen, can damage your stomach. They can cause ulcers. They can cause bleeding. They can damage your kidneys, especially if you've already got kidney issues. Stronger arthritis medications can cause serious side effects. Steroids make you weak and can damage your bones. Biologics can suppress your immune system and make you vulnerable to infections. And the thing is, if you're just stiff and achy, if you move around and it goes away, you don't need these medications. Move. Gentle movement is the best treatment for arthritis. It keeps your joints moving. It keeps your muscles strong. Swimming, walking, gentle stretching, Tai Chi, yoga. These things actually help arthritis, and they don't have side effects. They have side benefits. Take a warm bath or put a heating pad on the joint. Use ice if it's swollen. Both help. Over-the-counter pain relief, acetaminophen, is safer than NSAIDs if you really need something. But often you don't need anything. You just need to move. If you're on arthritis medication and you're not sure you need it, or you're having side effects, talk to your doctor. There's a good chance you can stop it. So let's be clear about what we're saying here. We're not saying never take medication. We're not saying all medications are bad. We're saying, don't take medications for things that aren't actually making you sick. Don't take medications for numbers on a chart when you feel fine. Don't take medications that make you feel worse. Don't take medications just because the system tells you you're supposed to. The goal of treatment should be to help you live better, to help you do the things you love, to help you feel good, not to make numbers look better on a chart. Here's the wisdom you need to remember. You've lived a long time. Your body has gotten you through 80 years. Your body knows things. Your body talks to you. And if your body feels fine, then probably you're fine. These 5 things, high blood pressure, high cholesterol, osteoporosis, diabetes, and arthritis, these are not diseases. They're signs that you've lived. And while they might need some attention sometimes, they don't need the medications the system wants to give you most of the time. The real path to health as you age is simple. Move your body. Eat real food, sleep well, Stay connected to people. And don't take medications for things that aren't actually making you sick. That's it. That's the secret. And it's free. So here's what I want to ask you. Are you taking medication for one of these 5 things right now? And if you are, does it actually make you feel better? Or does it make you feel worse? Think about it. Really think about it. Because the answer to that question might change everything. If this video opened your eyes to something, if it made you think about your medications differently, would you do us a favor? Hit that like button. It helps us reach more people who need to hear this message. For more senior wellness tips, join our senior community. Thank you for listening today. Trust yourself. Trust your body. And remember, aging isn't a disease. It's a gift. Be well. Take care of yourself. See you in the next video.